Okay, this is Exercise Phys Lab 2. This is a video on resting and exercise blood pressure. I'll go through this. It's some previous videos that we filmed on the procedure and the different ways that we take it in the lab, some of the different cuffs that we have, but you won't be able to hear the sounds, the actual Kirov cuff sounds from the stethoscope. So what I'll actually ask you to do is head to YouTube, and people with better recording equipment who actually sort of tapped into a stethoscope and actually recorded those sounds. They have really good versions and recordings of it, and I think that online, if you Google it, there's an actual calculator that can take you through and has sort of an assortment of randomly sort of generated, or a bank of sounds as you see the needle moving, and then you can practice putting in the actual measurement that you think you saw. And again, blood pressure is a very sort of practice skill. If you don't do it as often, you're going to sort of let that skill get rusty, and you're going to need some practice before you're willing to do it again in a sort of a clinical setting. So I'm going to run through here a little presentation, but in general, I'm going to let the videos do the talking. There's some videos that were filmed prior that our Workspace student Brianna did, and I think they're great, so I'm just going to use those. And then I have a little excerpt from an exercise blood pressure that we have an expert, a cardiac rehab expert doing. So I'll run through that now. Okay. I'll sort of be adjusting the audio levels throughout, hopefully keeping them fairly standard. I'll be watching them, but sorry if some are a little quieter and some are a little louder in these videos. Okay, so I'll let this run.
Before you start your blood pressure measurement,
That one's pretty quiet.
have the participant seated and resting with his or her left arm on the table and any sleeves rolled up. You will need a blood pressure cuff and stethoscope. Ensure the participant has their feet uncrossed and resting on the floor. The teaching lab has a couple different blood pressure cuffs available, and each is outlined in another video. You need to make sure you have the proper sized cuff for your participant. Their arm should fit inside the range shown on the inside of the cuff. If it doesn't, they may need a smaller or larger cuff. Each cuff has marked out where the brachial artery should line up. Most cuffs have a dial for inflation and deflation of the cuff located on the pump. Do not tighten or loosen the dial too much because it could get stuck in this position. Turning the dial to the right will allow the cuff to inflate. Make sure you are turning it a quarter turn to the left before inflation to prevent it from getting stuck. You can now read your blood pressure measurement on the gauge. Once you've gotten your blood pressure measurement, turn the dial all the way to the left in order to let the air out of the cuff. To place the cuff, line it up with the brachial artery and make sure it is approximately 2 inches above the elbow on the left arm. Secure it tightly. Place the gauge in a spot where you can see it. Some gauges can be clipped onto the cuff, while others are part of the pump. Check what pressure is needed to hear the heartbeat by the stethoscope by palpating the radial pulse and pumping the cuff until you can no longer feel the pulse. Locate the brachial pulse by palpating. You may need to dig under the biceps to find it. You will be placing the diaphragm stethoscope over this location. The earpiece of the stethoscope should be angled towards your face. Check that it is on by gently tapping the diaphragm. Place the diaphragm of the stethoscope over the brachial artery, but be sure not to place it underneath the blood pressure cuff, as this will create noise for your measurement. Turn the dial on the pump all the way to the right and then a quarter turn to the left. Inflate the cuff slightly past the pressure that was needed to stop the radial pulse, and then slowly release the pressure by slightly turning the dial to the left. Listen carefully. The first loud heartbeats you hear is your systolic blood pressure, or the top number. Take note of the number on the gauge. In this video, it is 118. The diastolic pressure is the pressure where the sound becomes muffled or cannot be heard. Take note of this number. In this video, it is 74. Release the remaining air by turning the knob all the way to the left. The blood pressure for this video was 118 over 74.
Okay, so one thing I will say, if you haven't watched the manual heart rate video yet and you haven't palpated for your radial heart rate, the easiest way to do that is to, without getting too away from my mic here, is to palpate for the radial styloid, just sort of at the base of the thumb on the wrist there. Once you find that, take the pads of your index and pointer finger, place them on either side of that radial styloid, roll them medially in between that styloid, and now you'll see a little groove in between the flexor tendons. And then if you press the pads in with some gentle pressure there, you should be able to feel the radial pulse almost immediately. Some people are very, very faint, and some are a lot stronger. So it helps to practice on a couple different people, especially if you feel like you're not getting it right away. Just try another person, and you might go, oh, that worked way, way better, and you were landmarking correctly the whole time. Okay, moving on.
The teaching lab has a variety of blood pressure cuffs that may be used in the lab.
Turn that one down a little bit.
Participants' arm be too large or too small for a cuff, there are other sizes available. All cuffs have labeled where the brachial artery should line up. Physiologic cuffs have a separated pump and gauge. To inflate the cuff, turn the dial on the pump all the way to the right and a quarter turn to the left. To release the cuff after taking blood pressure, turn the dial all the way to the left. Be sure not to turn the dial all the way in one direction, as it can get too tight and become stuck. Welch-Allen cuffs are similar to the physiologic cuffs because they require you to turn the dial to the right to inflate the cuff and to the left to deflate the cuff. The pump and pressure gauge are on one unit on these cuffs, and the cuff is interchangeable with different sizes. ADC blood pressure cuffs have the pump and gauge as one unit as well, but they have a switch in place of the dial. Lift the switch to inflate and press it down to deflate the cuff.
So personally, I really don't like the switch ones, and I wouldn't use those. We actually have one more kind of sort of newer cuffs in the lab where it doesn't have the separated gauge and pump. The gauge is fixed to the cuff itself, so you don't have to clip it on. They're these nice they're basic Welch-Allen ones. They're not the adjustable cuff ones, so you can't swap out the sizes. We just bought a bunch of mediums, but I think they're sort of a basic, great learning tool, and you'll see those in the lab. Okay, so here is a quick video of our expert doing the blood pressure, and I'll talk over this a little bit. I'm going to turn this down because I know this one's loud. Okay.
One second while you're here, let me do your blood pressure.
Okay, so notice how she's actually wrapping the blood pressure cuff around a large Lysol wipe. She said that's actually fairly typical of what they do at the hospital for cardiac stress testing patients.
You took the pills today?
I did. Notice how Ellie the whole time is talking to the patient, putting them at ease, making sure that she's conversing with them, all while doing her job and taking the measurement. You can see that she's done this 1,000 times and is truly like a pro's pro at it.
What's it normally?
So even while he's talking to her, she can still take the measurements.
Morning, but that's not unusual.
She's confident enough, even though it's much different than what he told her. She was immediately able to get that measurement. She leaves the cuff on, so now she has her baseline. They're going to walk over. This is in the warm-up phase of his stress test, or stage 1 of his Bruce. You can see his 12-lead ECG on the screen here, displaying his heart rate here. From the ECG, we actually don't have the automatic blood pressure cuff on. Ellie's going to walk over here. You can see her immediately sort of stabilize his arm with her offhand, either on the elbow, or sometimes people will take the arm and put it in the crook of their armpit and then sort of squeeze it to stabilize that loose arm. Especially on a treadmill test, it's really important that you stabilize that arm and you don't have them arrest it on like the rail of the treadmill, because it will be bouncing around a lot, creating a lot of extra noise. Okay, you can see how she's multitasking, doing a bunch of different things, checking the metabolic machinery here that is doing his gas analysis for his VO2. And now we can see that she's back on this side as he's getting into the next stage of the Bruce. Again, taking it, you'll see her stabilize the arm, pump the cuff up. And now she knows generally what she has to pump the cuff up to, because she did it at resting. And once So she's not palpating for the pulse. We ask you that you palpate for the pulse most times, but sometimes you just don't have the time for that during a stress test. And if you've done enough times, they just err on the side of caution, go a little higher to make sure they get that systolic. And now once the test is done, you'll see that she immediately grabs the arm and takes one during the cool down as well. And again, every time she does this, it's super fast, probably under 20 seconds each time, 20-30 seconds from start to finish, and then immediately goes over and records that measurement. So that's, I'm going to stop that there. That's what a exercise blood pressure will look like. Again, it just takes a ton of practice to get this right. So the more practice you can have just sort of listening to the sounds on either a YouTube video, but then practicing it in person when you get a chance is only going to make you better, and definitely take a little bit of a refresher if you're ever been away from it for a little while and you need to run a clinical test like this. Thanks for watching.